Hello, hello.
Hello, everybody. Welcome back to another episode of.
Getting that
Uh,
medical degree. Today's
all right, right
topic
on
is
cue.
Naplex. Alzheimer's.
Alzheimer's.
Yeah.
That's right.
So this kind of goes with Parkinson's being like it's a small. You think it's a small topic, and I think the Arch Prep book's like 2 or 3 pages. But again, I had a lot of questions on this, either on like rotations and also on like the Naplex itself. I had a decent amount of topics on, which kind of shocked me, but I knew it pretty well because I listened to podcasts. I studied the book pretty well. So it wasn't too bad. So that's what we're gonna go over today. So first up, we're gonna talk about some anti-cholinergics. So oxybutynin, Benadryl, benzodiazepine. These can actually cause acute cognitive impairment. So if you're seeing someone who's like saying they're starting to forget stuff all the time, but not really diagnosed with Alzheimer's yet, you want to see if any of these medications are actually listed on their med list. Because this can actually cause them to forget stuff and make them think they have Alzheimer's, and they actually it's just their medications causing their issues. So, which is never a good thing. So always check the med list before you start assuming things. Some natural products you can use is vitamin E. So that's a 2,000 IU per day, which is a good, a lot of vitamin E. And also ginkgo biloba. I probably did not pronounce that correctly, but ginkgo. So those are pretty important to know too, because they do like asking you dosing of like natural products for whatever reason, and they do like asking you natural products or like non-prescription items for treating disease states. So it is pretty important to know these. Drug treatment though, you have acetylcholinesterase inhibitors. You either use these alone or with memantine, which is Namanda. So as of right now, there is no actual cure for Alzheimer's, but hopefully that changes within Maya Mitchell's lifetime. Hopefully we can actually see that happen because everything's starting to get better and better. Medications are, and we're figuring some stuff out about Alzheimer's nowadays. But right now, it's no cure. These medications just slow the progress of Alzheimer's. So mild to moderate Alzheimer's, you're gonna start donepezil or Aricept, which is usually the main one you'll see, or you can use rivastigmine or galantamine. But donepezil is probably the main one you'll see used, especially in like the retail setting. Then for moderate to severe, you want to use basically use like donepezil and then add memantine to it. So yeah, not much really there for the treatment wise. It's pretty simple, but let's go on. So screening wise, there's a thing called MMSE. Basically, 30 is the max, and if it's less than 24 is a memory disorder. There's also like a MoCA scale and a DSM-5 scale. Honestly, I think just knowing the MMSE less than 24 is a memory disorder is probably the most important thing to know here. There is a clock test they do make patients do where they tell you, hey, draw a clock and draw all the numbers in the right spot and draw a certain time. But they're wording when it's kind of confusing on purpose to kind of make the person think. So if the memory is not good, they'll be drawing the clock that's supposed to be for like noon, and they'll draw for like 6 p.m. or something like that, or like 6. So it's the clock test is actually a pretty common test you'll see for Alzheimer's, but I don't think the RX prep book actually talked about it, but like rotations actually showed you like actual people's clock tests and how like they differ over the years as they progress in their Alzheimer's. But that's not really that important for the Naplex, but it's just interesting to know for your knowledge. Last but not least, we'll talk about the drugs themselves. So they're acetylcholinesterase inhibitors, like Napazil, which is Aricept. They have cardiac effects, including like bradycardia, it means slowing down your heart. Aricept has an oral disintegrating tablet, which means the patient puts the tablet in their mouth and this disintegrates automatically, pretty quickly, which is pretty interesting to know. So basically, you take 5 milligrams every night. So Q means every, HS means bedtime. So every night at bedtime, to help with like nausea. Now, if a patient does increase their dose to like 10 milligrams and they're like kind of stable in it, they can switch to a product called Namzaric, and that is a combination of memantine 7 milligrams and donepezil 10 milligrams. This is just so they only have to take one pill instead of just 2 pills, especially if they're getting that more severe Alzheimer's. And the ODT form has less like stomach effects, so it affects your stomach less, which is always good. Rivastigmine is Xelon, and that comes in a patch. I mean, that's all you need to know about that one. Know that if they're asking about like which dosage form would be best for this patient that prefers a patch, Xelon or Rivastigmine. They love this type of questions, especially if they just give you random names that you recognize, but you just figure which one has which, and which one has an ODT, which is Aricept. And then Memantines and Amanda. Remember to know the brand names while they're on the slides. That blocks NMDA. Again, just know that mechanism. It can cause like dizziness, confusion, headache. Really don't really care too much about that. But if they're having trouble like eating, like taking that medication, you can actually like open it up and sprinkle in their applesauce if need be, which is pretty neat, especially if it's an older patient who just kind of struggles to get pills down. So yeah, that's really all I got for this, guys. It's a pretty short chapter. This and like Parkinson's is
All right.
fairly short. So yeah,
All right, guys. Give it a thumbs up, please. And subscribe. We have a lot more of these coming.
yes, I think there's like 80 some topics or something like that. So yeah, we'll get there. Peace, guys.